Hello everyone, Dr. Stillman here, and today we are going to be tackling a really important topic that I love talking about, thinking about, and researching, which is, are vitamin D supplements, or could vitamin D supplements be dangerous? This was inspired by a post that I made on Instagram where I talked about the importance of maintaining your adequate vitamin D levels. I use supplementation to do this in some patients, and when I say supplementation, I mean pills full of vitamin D. And I got some comments that said, well, it's really bad. You can't use supplements from vitamin D. They're synthetic. They're not equal to the sun. Their benefits are overblown. Let's unpack this and talk about what's really going on with vitamin D supplementation and how to understand how both sides of this vitamin D supplements are bad, vitamin D supplements are good argument can have some valid points and therefore inform how we approach vitamin D supplementation. So, without further ado, we're going to start by talking about what I think is the most important question whenever we're dealing with a question of should we use this therapeutic, that therapeutic, how much of it should we use, how long should we use it for, et cetera, which is what does the all-cause mortality data say? All-cause mortality means who dies, how much they die, and over what period of time. When you're asking the question, is vitamin D good for you? You're typically going to get people telling you that the higher your vitamin D level, the lower your risk of death and the lower your risk of many other diseases. And the lower your vitamin D level, the more your risks of certain diseases and death tend to go up. That's true. This is not the same question as should we take vitamin D? Because saying your vitamin D level is low, and if it's low, you're more likely to die or get disabled or sick, why is it low, right? This is like saying, oh, the bathtub level is low, we should add more water. Well, what if there's a hole in the bathtub? The solution to a leaky bucket is not more water, it is to fix the leak in the bucket. Okay? So, what happens when you supplement people with vitamin D? Does it reduce their all cause mortality? Does it increase their all cause mortality? This is one of the biggest studies on this. They did a 3-year randomized controlled trial with 4,000 units of vitamin D every day. That's a hefty dose, but not nearly so hefty as many of my colleagues are using. And what indeed did they find? They found that this dose did not reduce mortality in patients with advanced heart failure. It's a very specific patient population, but was associated with a greater need for MCS implants. What does that mean? MCS, or mechanical circulatory support, is it refers to a variety of interventions that improve the circulatory function of the heart through mechanical means. Okay, it's not good. This implies that a bad outcome was more common in the vitamin D supplementation group. Why is this really important to consider? And why do I think it actually makes sense? When you look at vitamin D metabolism, it depends upon minerals and it affects minerals as well. If, for whatever reason, excessive or additional exogenous, i.e., pills of vitamin D, had a negative impact on some of these minerals in heart failure patients who have atrocious mineral status, it could increase their need for or the failure of their heart in certain ways. Now, I would like to point out that not hardly anyone listening to my videos or coming to see me in consultation has heart failure. Why? Because heart failure is rare and it affects people more and more and more as they know less and less and less about health and wellness, which means that people coming to me who are very highly informed and constantly doing research and typically younger and more tech savvy don't wind up with this issue. When you look at the vitamin D data in, for example, the multiple sclerosis patients, their experience with vitamin D supplementation is so profound that it is, even amongst the most conventional of conventional doctors, the standard of care to give you vitamin D supplementation. This means that different groups of patients need to be taken on different terms because they're all unique. You can't just say vitamin D supplementation is bad. This is a very simplistic way of thinking. It leads to all kinds of errors. I've already unpacked a little bit of why I think it makes sense that vitamin D administration in heart failure might create a problem. Okay. But again, the MS data is completely different. What I want to point out here, though, is that it didn't reduce all cause mortality, which means the people thinking, okay, I'm taking vitamin D and I'm taking fish oil, I'm done. That's my wellness routine. No, it's not. That is not a wellness routine. You can't just throw vitamin D at problems and make them go away. I've yet to see that happen in clinical practice. It may be possible. That would be great. Okay, all-cause mortality according to serum hydroxyvitamin D. This is very clear. The lower your vitamin D level, the higher your risk of mortality, morbidity, etc. Let's talk about this. When you're looking at any level of any biomarker or metabolite, there are two questions that need to be asked. Number one, is there adequate supply? Number two, what is the status of demand? The storage form of vitamin D is converted into the active form. This is a magnesium dependent reaction, as is the production of vitamin D, which means that vitamin D supplementation in people with magnesium deficiency is a really loaded gun, in my opinion. So if you don't have adequate intake, it'll be low. You can correct that with adequate intake or exposure to the sun. And that's where you see the massive improvements in people's health. People feel so much better when all of a sudden there's enough vitamin D coming into a system that's been starved of. That may be, objectively quantifiable, as in, they wind up with lower or better improvements in their bone density, and it may be totally subjective. I feel better, I have more energy, I'm sleeping better, I'm getting sick less often, whatever. But you also have to consider the other side of the equation, which is how quickly is it being consumed. I've seen cancer patients soak up tens of thousands of IU of vitamin D a day and still have low storage levels. Why? The vitamin D is getting the signals from the immune system in those specific cases to hyperconvert. I call it hyperconversion. I think I've made that up. It's hyperconverting it over into the active form to try and get rid of the cancer, which is the clear and present danger to the organism. So no matter how much you dump in, you need more. Is this good or bad? We're going to talk about that. Association between vitamin D supplementation and mortality. This is a systemic review and meta-analysis that looks at more studies than the one study we started with. And indeed, they found that supplementation was not associated with all-cause mortality in adults compared with placebo or no treatment. Vitamin D supplementation reduced the risk of cancer death by 15%, which makes sense given what I just told you. Larger clinical studies are needed to determine whether vitamin D supplementation is associated with lower all-cause mortality overall. I guarantee you this is going to be disease specific. And if you were to stratify it according to a bunch of other factors, you would find out that there were other things that determined whether or not the vitamin D supplementation affected mortality, morbidity, etc. Inflammation and vitamin D, the infection connection. This is some very nice thinking from these researchers on why it may be that supplementing vitamin D is not adequate to solving a low vitamin D level. And what they propose is that chronic infections and inflammation cause this increased conversion of storage vitamin D into active vitamin D, which creates the idea that low vitamin D levels create disease. What you're really seeing is that people who are living wrong, eating wrong, not having a healthy lifestyle create the circumstances for chronic low grade infections and inflammation that then sets them up for vitamin D deficiency, because this low grade infection inflammation is consuming vitamin D and converting it from storage into active. When you give these people adequate vitamin D, their immune system may actually respond appropriately and clear the infections that they had, and they'll feel better. Again, this goes back to why some people feel better on vitamin D and some people don't. And it does depend on the dose, and it does depend on the case. It depends on all kinds of other factors, which is why when people ask me questions like, should I supplement with vitamin D and how much should I use? When they're a patient, I'm doing 1,000 little thoughts in my head to figure out what's right for them. What's their latitude? What's their lifestyle? What's their occupation? What's their skin type? What's the rest of their nutritional status doing? What's the rest of their lifestyle like? What are their risk factors for various different illnesses that will affect or be affected by vitamin D metabolism? There's a lot that goes into this decision, which is why I don't just come out and say everyone needs this, that, or the other thing. Okay. But my point is, this thinking is very clear in the literature. It doesn't get translated to regular folks, and it certainly doesn't get translated into the wellness influencer, whatever world, because it's a lot easier to just go with all of you are low, all of you need a supplement, buy mine at my 20-30% markup, whatever. Fish consumption and all cause mortality. There is a massive reduction in all-cause mortality with fish consumption. Isn't it interesting that you can look at the studies on fish consumption, and there's a clear reduction in mortality with fish consumption, and there's not a clear reduction of mortality with vitamin D supplementation. I always tell patients, and vitamin D are one of our top sources of, or sorry, fish are one of our top sources of vitamin D, depending on the type, depending on how much you eat, et cetera, et cetera. But fish are not just a source of vitamin D. They are a source of omega-3s. They are a source of minerals, particularly iodine and selenium. They're also often high in things like magnesium, potassium, and calcium. So you see, when we look at things from this perspective, we see that the nutrient vitamin D that's in the fish doesn't reduce all-cause mortality, although higher levels are associated with better, will reduce mortality and better health, right? When we look at the fish, it clearly reduces mortality. This is why I'm a huge fan of whole foods. And I'm a big critic of people who try to deconstruct the food and use supplements to make up for a bad diet and unhealthy lifestyle. The other point that must be made is that vitamin D levels tend to be a surrogate marker for sun exposure, which is also a surrogate marker for latitude, which is also a surrogate marker for lifestyle. The people who live in dark places and don't go outside very often with their skin exposed at bright UV, high UV times of year or day tend to get sick and stay sick. They're under more workplace stress, etc. Their problem isn't just low vitamin D. They're likely to have low vitamin D because they don't get enough sun. But the minute they go outside and start getting more sun, they're not just getting more UV light. And they're not just getting more vitamin D from UVB. They're getting UVA. They're getting infrared. They're getting visible light. They're outside and they're in the heat and they're on the beach and they're with their friends and they're having fun, or maybe they're having a cookout, or maybe they're paddleboarding. There are all these other factors that make them healthier about getting the sun exposure. And this is why it's so important not to get narrowed in on, should I take a vitamin D supplement? What I recommend that you do is work with somebody like me who's going to look at the whole picture and say, you've really got to get out and get 20 minutes of direct sun with your shirt off in the middle of the day at your job, if that's practical. And you may say, Dr. Stillman, that's a little awkward and weird. We can't make that happen. And I may say, well, in that case, let's get you a spurty vitamin D lamp. There's a lot of different ways to do it. But the point is simply this. People will do this thing with supplements where they say, be afraid of this supplement because of this study. You have to take a very broad view of the literature and ask, were there significant negative effects on mortality from taking this supplement for a prolonged period of time? In the absence of the negative effects, or even in their presence, were there some benefits? A 15% reduction in all-cause mortality for cancer patients? And you want to tell me that vitamin D supplements are bad? Far be it from me to say that every cancer patient needs to take vitamin D, and the vitamin D supplementation in cancer patients is the best and most important thing for any one of them. No way would I say that. But to dismiss an entire class of therapeutic supplements because you have a couple of negative studies or a couple of hunches based on your reading of the biochemistry or the literature or whatever really misses the mark as far as what actually happens in clinical practice. And that's why I'm very cagey about recommending for or against vitamin D supplementation. And it's always recommended on a case-by-case basis. And whether I use a spurty vitamin D lamp or sun exposure or a supplement or increased fish consumption or say full-fat dairy, always depends upon that unique case. So as always, thank you for watching. Don't forget to like, share, comment, subscribe. Make sure you're following my Telegram channel and make sure you're signed up for my Substack blog where I'm putting out great content to help you understand how to be healthy and well. And go to my website, stillmanmd.com, to apply for a consultation so that we can help you figure out how to live your best life and be the healthiest version of you. Take care, everyone. Have a great day. If this video has been helpful to you, make sure that you check out my link tree below to find out how you can keep in touch with me best. And if you would like to become a patient at my practice, please apply to work with me at stillmanmd.com. Thank you again for watching. Have a great day.